Rough day.
You have no idea.
Let's talk about it.
Being a woman has its advantages, but it's not an easy ride. Balancing careers, relationships, motherhood, family, and life can be quite the challenge. Sometimes you have to be a lady, and sometimes you gotta be a broad. Welcome to the Two Broads from Boca, the place where we talk about all the things you think about but don't say out loud.
Hey everybody, welcome to the Two Broads from Boca. I'm Dr. Amy Schreiber, and this is my lovely co-host.
Lorianne Gary, happy Monday, everybody.
It's Monday again. It goes so fast.
It does go fast.
But we make Mondays better, so that's all right. So we have a lot to talk about. We have a very interesting show this evening.
I noticed that Amy's exceptionally happy today because she had a little hiatus
I
by
did.
herself.
It was
Kid-free,
Kid-free, husband-free. It was no cooking. It was gorgeous. People waited on me. I will tell you a funny story. Santa Fe was really nice, and the conference went really well. I'm walking back to my hotel room on, I think it was Friday evening, and all of a sudden there's this like room open and there's people coming in, and I'm like, oh, is this, idiot, is this a wedding? And they're like, no, it's a military party. And they were all in there getting drunk and whatever. So like, come on in. So I'm like, all right. So I went in.
Like a guy in uniform. Oh,
no, they
don't
weren't
check it
in
out.
uniforms.
Oh, okay.
So I walk in and they're like, oh, what's going on? And I'm like, oh no, they just invited me. And they're like, are you military? I said, nurse, Navy. And I went like this. And all the guys came out. They're like, oh, hi, you're a nurse. Let's talk. And I'm like, honey, I'm way older than what, for you. And they were so charmingly, granted, they were drunk, but they were so charming.
They were drunk.
It was so much fun. I felt like I was 25 years old again. Still got it
Did
at
you
55.
have a drink with them?
I did not, because I feared for my life. So I left, but it was fun. It was very nice. I enjoyed it. It was a lot of fun.
So how was the conference?
Conference was really good. Very well received. Invited back again next year.
Oh, good.
Yeah, so it was fun. Actually, at
What
one
was
point,
your topic?
Dementia.
Oh.
And all the there's 10 different types of dementia, so it was very interesting. But what was funny, at one point I'm talking, and it just occurred to me, the symptoms that I was describing was like a teenager. I said, well, if any of you have teenagers out there, you may want, it was really funny. But,
so now the people that were at the conference, are these all
nurse practitioners.
They all, okay.
All the one in September will be DNPs, Doctors of Nursing Practice. So I'm really looking forward to that, because it's national, so there'll be like 10,000
And that's
people.
the one in California?
Yeah. You
Okay.
should come, Palm Beach. I mean, Palm
Beach, I'm like,
Palm Springs.
Springs.
Go to the desert, do a little Coachella. You should come.
Coachella.
Prosecco. I drank 2 glasses of Prosecco.
I know,
and
and
it
I
was
was
really
not there
cool.
to
I know, it was
witness.
so much fun. I slept like a baby. But the best part of it was one of my childhood girlfriends, Angela, was there for her birthday, and she's recently engaged, and her son and her fiance were there, and we got to see each other, and I had more Prosecco. It was fabulous.
Oh,
It was
that's nice to catch
Four
up with an old friend.
Seasons, Santa Fe, it's a must-do. I have
Well,
to
I
tell
don't
you.
understand. You showed pictures of your view from the Hilton, which was nice and
It's a little
dry,
Hilton,
like dry
very
toast.
dry like toast. No,
But
this was.
you didn't
it was-
take any pictures from there.
because I was drunk, so that's why. But it was spectacular, and it's so dark, and all you see is this one hotel just all lit up, and there's nothing else around. You could. Let me just say this: if you want to kill somebody, Santa Fe is the way to go.
Oh, great.
Won't find you for days,
There you
and the
go, the tip
coyote
of- tip for your
tip
Monday
of the
there.
day, and the coyotes would get you them. There would be nothing left.
Oh, great.
Yeah, I'm not kidding. And they have
All
like
right.
an ordinance, like after a certain time, you can't make noise because you don't want to disturb the wilderness. Yeah, I'm telling you, it's amazing. It's scary.
Doesn't
It's
sound like
No, I
my
slept with
kind
the
of
TV
place.
on. It's a little crazy. But that was Santa Fe. So the royal name is Prince Louis Albert Charles. Wasn't
Now, wait a
even in the
second.
ballpark of what was going on.
Now,
I said,
is it Louis or Louis?
well, it's Louis. I don't
Is
like
it?
Louis.
Is it Louis?
It is Louis. That's how they pronounce
Prince
it.
Louis sounds very royal.
It sounds very gay. No, it does. Prince
Yeah,
Louis.
but you were way off. You were George.
No, I wouldn't say George. I was
Yeah, you
Philip
were.
Eric James.
Yeah, the
Wasn't
Eric
even
was-
wasn't even in the ballpark. Not even in the realm of possibility. I don't like
I
Louis.
like it.
I don't like Louis.
I like it. I think it's cute.
Louis. No. No, it doesn't sound regal to me.
But I like the meaning behind the three names. All
I
in
do
the
too.
family,
I do
which is
too.
It's very
That's all
meaningful.
right.
That's why
That's
I
all right.
like
The
it.
royal wedding's coming. She's 18 more days. I'm very excited.
18 days?
Yeah, she's getting married on the 18th.
Wow.
Yeah, I'm very excited. I'm very, very excited because I really love her and I want her to have a baby like yesterday.
I'm
I
sure
think
they'll
she's
be working
gonna.
on that,
She's 36.
right on the night of the wedding.
You think? I think Harry's adorable though.
Yes.
He's so
We'll
cute.
have a
Reminds me
nice
of my
little ginger baby.
Well, I don't know.
No, the dark's usually dominant, right?
Yeah,
She's
she's
dark-headed.
dark,
Yeah.
so she might. But look at me, I had a gingy.
That's true.
Yes, I don't know.
But you're not natural.
No, this is my hair color. I just enhanced the brown. I mean, I'm Italian. What else do you
All
think
right,
it was
calm
going to be?
down.
No, I have the grays. They're coming. I called it glitter. My glitter's coming. I have to go do that because I have to. Oh, guess what I'm doing on May 11th? Colonoscopy time. So much fun.
Right before Mother's Day.
Right, well, that's
a nice present.
Good times. Maybe I'll lose another pound. But yeah, so I have to change my hair appointment because I'm having my colonoscopy on my schedule.
Yeah, I don't think you need to get your hair done for that.
Yeah, no, I was gonna do it before, so I'm hoping that we can. I already spoke to my hairdresser. I'm like, let's figure this out. I don't know. Is that inappropriate to call them hairdressers? What are they? Is that a hairdresser?
Hairdresser, hairstylist.
Hairstylist. That's what it really. But she doesn't style. She just colors it. So she's a colorist.
Colorist.
I
there
spoke
you
to
go.
my colorist. Yes, Mother's Day is coming.
I know.
What are you doing?
I have no idea.
Me neither. I got a feeling.
We go through
Not
this
much.
every year. What are you doing? I don't know. I don't care. I'm not big on going out for brunch. I do not like the crowds. I
No,
don't like the
I don't either.
service. Usually it's,
I like to go to the beach.
yeah, just relax.
That's what I like to do.
Reason to do.
I
Put
am not a
everything
big.
aside.
Well, you want to hear what happened to me in the supermarket? I had to buy a card for some reason. I don't even know what I bought the card for. And it wasn't for Mother's Day. It was something. Oh, my sister-in-law's birthday, and they were giving the cards to buy one get one free. So I was like, David, go get a Mother's Day card because you're never going to get one anyway. So get it now. I said, you get it for free. I said, you don't have to. That's sad. That was
That is
sad.
sad.
That's sad. That's sad. Don't you think that's sad? Blake, what are you eating there? Is that a sweet potato?
It is.
I'm a fan of this because you're a sweet potato. No, but I do enjoy a sweet potato. Blake is a human sweet potato.
Yes.
I posted something today that I thought was very funny.
What?
Did you ever meet the human version of a headache?
Yes. Every day.
Every day. I thought it was really funny. There was a lot of things. I was in the posty mood today. And don't you love when people, see, this irritates me. When people will text you, was that about me? First of all, you love yourself. Second of
Yeah, I was
all,
going to say it's
no. Second of
very,
all, I would like to understand. Guilty conscience needs no
Yeah.
accuser. If you thought it
Exactly.
was about you, well, if the
Okay.
shoe fits,
Right.
put it on, lace it up, and
Yeah.
go with it. I mean, seriously, stop.
I know.
Stop it. Yeah, I was really annoyed with that. My husband came to see me tonight.
I know.
Wasn't that a very sweet
Very
gesture? My hair
sweet.
looks awful.
It does not.
It does. It looks very
mine's
big.
Sticking up in the back.
No, you at least is long and thing. Mine is just looks big. It's the weather here is iffy today in Florida because we don't know. There's
Florida.
humidity.
It's Florida.
It's Florida. It's the Bronxese. It's called Florida. Do you want to know something? It
Yeah,
was-
did you speak like that on the mic?
I didn't.
See, she can control it
No,
when
it was
she
so
wants
funny. I
to.
said, as you all know, I said, I'm Dr. Raymond Schreiman. I'm from Florida. And
You said Florida?
I said Florida. And they said, I said, and as you also must know, I'm originally from London, and they all got hysterical laughing because you could still hear it, So they were cute because they don't speak with an accent over there. There's nothing. It's from all that dry heat. They don't have anything.
I could barely
They're
talk.
hypovolemic. That's it. They but it was so nice because I looked so nice, and no, they don't do that there. It's like clogs and jeans and a poncho, maybe a dress, maybe
Well,
a
if you
skirt.
lived there, I mean, I'd be walking around
Naked.
half naked, pretty much.
But it was chilly in the night.
But I love my bracelet. Amy got me
Yes,
a
I bought her
bracelet
a
from
bracelet.
there with
I
the
got
turquoise.
this one too. It's very
Matching.
nice. No, but yours is nicer. I got the cheapy one. I got you the better one. But I just
What a
like the
good
colors.
friend.
I am a good friend. See, friends put themselves before their friends. That's what you do when you're a friend. That's an Italian rule. Just saying. We're Italian. That's all I'm saying. I'm going to have
what we
another
do.
Italian here.
I know.
I'm so excited. Many vowels in the room. Blake, you have to leave. But
Yeah,
so-
you're the odd man
You're the
out,
odd
Blake.
man out. There's a Jew in the room. Here we go. But other than that, that's all that's been going on. What's going on with you? How are the kids? The husband? All good? Okay, she's not talking. Silence says volumes. That's all I can say.
All I can say is Dr. D's kids are older, so he can relate
And he survived.
to what we're going through right now. I'm sure he
people.
has flashbacks of these lovely teenage years.
Yeah, there was, of course, when I get home, the oldest son is not feeling well. So we got this like, in the back of the car blowing in the nose and, hi Mom, I don't feel good. I'm like, of course you don't. In my head, I'm like, of course you don't. But, it's rough, when you realize that you didn't have to do, I come back to a mound, like an ocean of
laundry, I can't even imagine.
And the best
'cause it
part
never
was,
stops.
my husband puts everything in the washing machine, whites, what I mean?
All at once.
I'm like, why did you do that? He goes, because I didn't really want you to see how much there was. I'm like, okay, that's
All right,
a plan.
but we got to go shopping
That's a
because I
plan.
destroyed half the clothes,
Yeah,
so
it was
let's
just,
go.
It was
But that
unbelievable.
nice
No, he
of
didn't
him.
wash them. He just shoved them in there. There was no washing of clothes going on. No. He just
That's even funnier.
Yeah, that's
okay.
not a wash was going on. No, he goes, the house is clean now. I'm like, okay. No, it wasn't. But that's okay. Their version of clean and my version of clean. I'm a nurse. We're very clean. That's all I could say. It was a disaster. That's pretty much. But he did take me out to dinner the night I came in. So that was
Very
nice. And we
nice.
went to that Luff's place.
That's good.
It was all right.
It's more of a beachy.
It was okay. It's a lot of money for okay. That's all I'm saying.
Yes. I've heard that.
But it's
I
fun.
have not been there yet.
I wanted to drink, but the kids were around. I don't drink in front of the kids. I think I should start. Don't you think?
Drink with them.
Just yeah.
Wouldn't you rather them do it at home in your presence?
Come drink with mommy. Let's sit down and
So
have
they can learn their limit
Yeah,
when they go
exactly.
out. They know.
Yeah, okay, yeah, that's not going to go over well. No. But anyway, so
My son worked all weekend.
Oh,
3
that's
days in a row.
good.
No, it's not good for me. This whole job thing is not good for me.
stop it then.
I mean, I'm
Stop
staying up till 2 o'clock in the morning because I got to go pick him up. He's working till 1, 2 in the morning. I'm like
UBER.
nodding off, waiting for him to
you.
call.
Uber yourself home.
That's too late. It's too much.
Yeah, be afraid. Yeah,
I'm
you can't do that.
exhausted. I'm
No,
exhausted.
you can't do that. Mine's going to the bagel shop. the end
That's
of
what
the
I
month.
mean. He needs something like day. I mean, he has not complained. He loves it,
Well, I'd love it too.
but it's too much for me until he. And then I thought about it, even if he does
the
get his
summer's
license,
coming, though.
I don't want him
No,
because when
driving
we're
a truck.
driving home, people are speeding
I
on
know.
95 all
Drinking.
over. They're drunk. Who knows what they're doing? And then I thought, well, even when he gets his license, I don't want him
Well, that's another thing that's coming
driving
up.
home at 2 o'clock in the morning
May
at
15th, we
at
gotta
17.
go for the permit for the other one, for the little one. I'm literally gonna start mainlining drugs because I can't. 2 drivers in the house, and then no, it's not good. It is not good.
And that's why it's adding to the bag situation, this new job, which is why we have Dr.
He's
Dardano
gonna
here,
show us how we
because
can all be beautiful
we
in
need mommy
less than 4
makeovers
visits. Yes, we
for
do.
Mother's Day and for
We're
summer.
gonna talk about bat wings and boob things. It's the whole thing. My bat wings are coming off. That before I'm 60, those bat things are going away. We're gonna donate the skin to the skin bank. We're gonna find a
I
way.
think that this idea, and we're going to take a little break in a minute, and we'll talk about this when we get back, but I think this is an idea that a lot of people, men, do not think about for their wives.
No, because I think sometimes men think that they may get in trouble.
They get it right. Their wife or their significant other might get insulted.
Bring it on, honey. I know my
So
limits.
We need to figure out a way to, like the subtle hint dropping that we usually do.
Please get me some Botox and stuff.
Leave little pamphlet, little
Yeah, that's
brochures.
a good idea. Leave the brochures. Do what I do. Instagram it. Let them see what you want.
Oh, that's a good
all.
idea.
Instagram. I
Like,
want
oh,
plastic
look
surgery.
at this special that Dr. Dardano is running.
Well, I think it's really important that you
I think I
understand
might want to try that.
that you're not
Sure.
gonna go. When you decide to go on this journey, you got to make sure you're going to a board certified person who knows what they're doing, is going to take care of you, not the guy in the van driving by and going, come on, I'll do you some injections. Not a
Yeah,
good
no.
plan. Not a good plan. All right, so we'll be back in what? 2? 1?
Yep.
Maybe
Don't go
1
anywhere.
minute.
I'll be right back.
Hopefully my hair will be better.
Hey, the two broads from Boca are taking a short break. We hope you're enjoying the show. You can find them here live on Facebook every Monday night at 7 p.m. And if you can't watch, you can hear the two broads on SoundCloud.com. You can also follow the two broads from Boca on Facebook, Instagram, and Twitter. Want to talk about a topic? Leave the two broads your comments on their Facebook page or contact them at 2TWO broadsfromboca@gmail.com. Let's rejoin the two broads from Boca and let's talk about it.
And we are back, and we have our lovely guest, Dr. Anthony Dardano. He is a plastic surgeon in Boca Raton, and he's a friend of the show as well, and he's decided to come back to talk to us about the joys of plastic surgery. I have to say one thing: you have to be a patient man, because I do not, being a nurse, I do not find that it is always easy to deal with people who want to change how they look. But you also have a different component, because you talk about the reconstruction of people, like somebody like me who is morbidly obese and then loses all this weight. So you have a dual kind of situation.
Well, they really have to figure out what the patient's vision is. 'Cause
Right.
if their vision
Realistic
is different,
vision.
then
It all starts with asking them what they want. And part of what we do during the consult, I call it psychosurgery,
It is.
because the consult is more an examination of not what the physical is, but why you're doing it, what's behind it, what do you expect out of it. I think some people have unrealistic expectations.
Like what?
Um,
Like I'm going to get married and have 4 kids.
yeah. Well, honestly, there are different body shapes and styles. And people will come in and say, I want to look like this. And they show me a picture of someone in a magazine. And
Good luck with
based
that.
on their body type, they're going to look nothing like that. So I have to back up and reapproach it. Say, listen, I can make you better, but you can't look like that. So if you say, I want something that's similar to this, fine, but I can't look like that. You can't make somebody who's big, big, big and round a little skinny thing.
That's a
Right.
shame.
It's just, if people wake up, yeah, I know.
I know, that would be nice.
If there was a way and I could figure it out,
priceless, that
I would do
operation.
it. But we really try to figure out what people are looking for. And 9 out of 10 times we do a really good job. I think it's the screening process.
And I think that is key. From being the person who takes care of your patient's post, I think it's important that people understand you have to be realistic, and you have to have a good team. Otherwise, you're going to wake up and either be very disappointed or, you know, in a very
I want to talk
unrealistic
about the
situation.
patient that comes in and says, like you said, they show you a picture.
Mhm.
A lot of these people I see walking around, or even celebrities or people in the media that are walking around, and they look deformed, pretty much, like, you know, big
Well,
lips,
even Michael
funny.
Jackson,
Yeah, I mean,
you know.
as a physician, when someone comes in and says they want to look like that, do you try to talk them out of
Or do you refuse?
Absolutely.
that
I refuse.
excessive?
You do refuse. See, that's integrity.
do.
I
enjoy
refuse. There's,
Because it's your reputation also. You know, where did I
Yeah.
get this done? Oh, I went to Dr.
yeah.
Dardano.
I turn down a lot of requests from people.
that. Okay.
They might want some reasonable things, and then they want to throw in something else. I'm like, absolutely not.
Like
No
elf
way.
ears or something. Do you ever
Yeah.
get requests for stuff like that? No, I'm serious. I really, because I don't.
No,
understand.
he must
My
see
question to you
everything.
is what kind of person does
People
that?
will show me something that they see in a mirror that I simply just don't see, or they have a finding. They'll say, "Oh, if you could just do this a little bit." I'm like, there's nothing I can do that's going to make that better. That looks fine. When I look at you, I don't see it, but they're fixated on it.
Okay.
It's like
And-
a dysmorphia type of thing.
Yes. Yeah, and there is a syndrome called a body dysmorphic disorder, where people just focus on things, and even if you operate on them,
Guilty.
they either focus on that or that it wasn't done enough. And then you get into the let me
wow.
just syndrome. Let me just fix it. Let me just do a little bit more. And that's kind of where you get into
You
the
get
Michael
freaky.
Jackson kind of
Okay.
phase
So I'm
where-
like, how do they go from normal to that? It can't be one shot. It's got to be.
Lorianne and I were at an event one time, and I said to her, I said, this has got to be the most frightening place we've. I mean,
Mhm.
I didn't understand, you know. And when is it okay to say stop? You know what I mean? I mean, I think you would have to have that discussion with your physician. But if you said stop, I'm sure somebody else
But
would
it's a
want to do
he's
it.
saying it's a lot more than that. It's like a
I
Psychological.
consider it a signature if I'm going to operate on you. Now I've put my name
On you,
on-
right?
on you,
Body by Dardano.
and if I don't feel comfortable with how it's going to look, I'd rather not do it. You can go somewhere else.
I enjoy that.
A good plastic surgery, whether it's, I say, exposed above the belt line or below or under a shirt, people really shouldn't notice. When you walk into a room after having a facelift or maybe having your fillers done, people shouldn't whisper and say, look, she had her eyes
Exactly.
Yes.
It should be, wow, she
look
really looks
different.
good. Amy looks good. She must vacation.
You're like,
Was
wow,
it
I
that
got a
trip to
lot of
Santa Fe
sleep
you
this
went on?
week.
Yeah, I got a lot of sleep.
I drank.
What is it? And then it's up to you to
Right.
say what you had done. That's what I think.
I
is
no,
good.
I think that's and I think you should not be embarrassed to say what you have done, especially if it's
No, if it
noticeable.
makes you
If
happy,
it makes
I
you
believe
happy,
that if it
you know
makes
what I
you
mean?
happy,
Like
you should
this
do
is
it.
what I want. I want those bat wings done. So let's talk about the bat wings, sir. That's a real thing. Mothers often have that particularly as you age or if you lose weight. What is that all
What she's
about?
referring to is excess skin in the upper middle arm.
Bat wings.
They call it a bat wing deformity. Often you see it after people who've lost a lot of weight or elderly. They get some excess skin that's there and they want it removed. And it causes women to not wear short sleeves or not wear tank tops during the summer. And they wear sweaters and jackets. And something that's easily fixable. It does require sometimes a two-pronged approach. We do a little liposuction to get rid of some fat, and then often there's a skin excision. There's some non-invasive things that you can do that tighten the skin, like high-frequency ultrasound and thermage, and tighten the skin, but sometimes they don't do enough.
No, they don't.
But
But
It's
it's
very-
good that you have that option because
Oh,
some
it's
people
always
say,
an
no,
option.
I don't want to,
There's always the
get
people
cut
that,
and
I want to
actually-
do this, but I don't want to do that. And they kind of handcuff you, and then you're forced to do something that's maybe not as good a procedure, so you get less of
Right.
an outcome.
Is the most common procedure you do breast implantation? In augmenting breast or reduction of breast.
The number one surgery that I do is tummy tuck, abdominoplasty.
There you go.
Oh.
Been there, done
And it's kind of a tie between liposuction of the same truncal area and or breast surgery.
Okay.
Breast lifts with augmentations, reductions.
Now, do you have to have augmentation if you
Blake,
lift?
please put up the photo of the tummy tuck since we're on the subject.
I
so we
love
can,
my tummy
so our
tuck.
viewers can see the
I had a
before
tummy
and
tuck in
after.
1991. You were probably still in medical school, and it's still good. And I had 2 children.
just
there.
graduated from
There
medical
you
school.
go. So they you would just start.
I was an intern
Yeah, well, I wasn't.
in New York,
Where in New York?
Brookdale Hospital. New
Stop
York.
the madness.
Yes,
There you go. We were right in the
Spent
same
a-
area.
whole year of my life there.
And then where
There's
did you do your residence? Your place of surgery?
I
stuff?
did my plastic surgery at the University of Texas in Galveston, Texas.
Nice.
Yep. Oh, there's the picture. You see the upper left photograph is a mommy, and you'd say, you know what? She's pretty
Pretty
thin.
fit, yeah.
She's fit. She's thin, and that's exactly what we see here in Boca. A lot of women really take care of themselves. They work out.
They
But
do.
if you look, there's she's got a little bit of a roundness to the front part of her belly button.
That's a baby.
There's some loose
Hold on.
skin and a belly button that's kind of an outie, and I call that the mommy's belly because we know that babies stretch and distort and do all sorts of
It's
things.
fabulous.
And you'll see the upper left is the pre and the lower left is the pre sideways shot, and you can see that there's kind of just a little bit of a bulge. And to the right, you see the post-op.
It's beautiful.
See just the way that the underwear sits on her.
I
It
enjoy
doesn't-
her underwear as well.
Yes, it doesn't
Very
go down
pretty,
as
nice
much.
and bright.
I do. I enjoy that.
Belly button looks good. Her stomach is nice and flat. And an abdominoplasty does 3 things. It tightens the muscles that have been stretched out after you have your kids, whether it's natural or a C-section. Sometimes a C-section's a little worse
I
because
had
they have
2 of
to
them.
separate it.
Yeah.
Yep.
It's so much fun.
It gets rid of the loose skin that's tightened there, and sometimes when there's stretch marks and other things there, you help
Took
pull
it
that
off.
away. So as you can see, she's wearing a very kind of small, thin line
She looks
underwear,
beautiful.
and the scar's completely covered.
Yeah.
And there's a side shot and the front shot, and that's one of my favorite things to do on the planet is to help somebody like that.
I want to
Yes.
come work for
When
you.
you fix mommies, yeah, that's what I call getting bikini ready,
Yes.
right?
That's one of the things we were saying. Get ready
recovery's-
for summer.
I wonder if
recovery's
they could
about,
do
a month or so.
thigh-plasty. Yeah, it's
Oh,
not
that's
bad.
it?
Recovery is
Mhm.
not bad at all.
I always thought they said, "Oh, tummy tuck's one of the worst
Oh,
ones."
I thought it was the best.
recovery.
I honestly had
Really?
I was up making my own bed the next morning.
If done well,
Wow.
my patients get a general anesthetic. There's a lot of different types of general,
Yes.
but they get a general before they wake up. I do something called a tap block, which is I inject a long-acting local anesthetic just in the abdominal wall, just below the fascia, to give a post-operative pain relief, and it blocks it.
I love
and really,
it.
women out of bed, walking around the
And
next
people
day,
heal better
Oh,
when they're
that's
not
they
in
great.
heal faster. Yep.
There you go. You want to put another picture up? It delayed. We're on delay. Here we are. You see us quicker than we see you.
One of these weeks we'll get it.
I know. Do you have another one of these centuries? Do you have another picture to put up? Let's see what we're talking about here. Lorianne and I are just very beautiful, and we don't need anything above the neck.
Well, we were saying that about Mother's Day. So Mother's Day is coming up, and a lot of people maybe want. And this morning I posted on Instagram, and one of the people that follow us said, "Well, what about a post-divorce refresher?" And I said, "That's a great time to
sign
get
me
refreshed.
up. There you
get
go.
divorced. You want a new look.
This is a nice
brighten
look.
up your look." So there's
Wow.
some other procedures you can get done that are not so involved.
That's
There's
amazing.
a non-invasive procedure. You can see on the left that the patient complained that I had those dark nasolabial folds whenever I wear makeup. It doesn't cover it up. When I see myself in pictures, it looks like I'm always frowning. In minutes, I can transform that into a smooth look.
That's
I
amazing.
love her chin.
She has
Like she had the
nothing.
dimpling chin,
Exactly.
and it went away.
So I
Gorgeous.
always try to, when people are looking at it, guess where I've placed the filler. Obviously, it's in the nasolabial folds, which is right between the nose and the mouth. I did some in the chin area and along the chin line and in the little submental crease to fill it in. And there's a lot less shadow, a lot less pouting, right?
I like it.
And with a little makeup on, she'll look fantastic.
That's
Yeah.
incredible. I mean, there's
A wrinkle's like a
crease.
valley. The light doesn't get in there. So if the light doesn't shine, it looks deep. And there's two ways to get rid of a wrinkle. You either fill in the base, or you fill in the valley, so light hits it, or you shave down the tops of the mountain. You know, it's kind of hard to do that. So we can fill it in.
That's beautiful. I mean, that is beautiful.
I mean, and her lines were pretty deep.
Deep.
So to have that.
I can't believe the chin underneath the lower lip. It's amazing.
Yeah.
We use a different mixture of products. I mean, essentially, they're all a hyaluronic acid, and to avoid getting into certain names, but people understand the word Restylane and
Right.
Perlane and Juvederm. It's basically like Coke and Pepsi. They're all the same. They're colas. They're all hyaluronic acids. They're
Right.
just different thicknesses and mixtures. Some last a little longer. Some are thinner.
What would be the side effect of getting this? Because people always ask, well, what happens to? Where does it go? What happens to it? Do you get balls in your face? You know.
No, luckily, it's a natural
balls in your
product,
face. What?
and
No, not testicles.
talking about granulomas.
I didn't want to say granuloma because nobody knows that
And
there's
I didn't want to say
little
balls, but
balls
that's
I know
of
that was a little delayed reaction, but it just hit me
Restylane.
like, what is she talking
not testicles in your face, but if that's what you like, have at it.
okay.
You know.
If injected improperly and done in large, like boluses of injections, yes, you can get the granulomas that are hard, but essentially, it's a natural
How
product.
much-
Your body breaks it
It
down.
comes in a syringe, the
Yes.
fillers. So how much do you, I'm just going to make this up. Say you use 10 units, okay, or half
That'd
a
be a
cc.
lot.
I know, but I'm just, well,
about?
she's bad. What do you do with the rest? Do you discard it or you save it for another visit? Or use
No,
it
you
for
can
somebody
save
else?
it.
Okay, you
It
do
has
save
a pretty long shelf life.
it. It does, okay.
So if I calculate, I'm getting pretty good at guessing, but it's an educated guess of how much we need to put in at any particular time, whether it's a cc. They come in either 1 cc syringes
Right.
or half. And if I don't use the whole one, we have a special sealer cap. It goes in a sterile bag, and we put it in the refrigerator. We can save it
Cool beans.
if you want to touch up later on.
I love that.
Yeah.
So you tend to mix different things to make the look like that.
Yes.
What is the difference between going to a doctor than versus going to a med spa?
I'll start off by saying there's some very busy med spas. There's some very busy mid-level providers that do a really good job of
Okay.
injecting. And I think it's because they've spent time either working in a doc's office, one-on-one and learning. But the difference is when you come to my office, you get me, and I do the injection. My nurse practitioner that works for me is also an excellent injector. She actually injects me when I need it, so I trust her. But I think we understand what's going on physiologically and anatomically, what's under the skin. I've seen what's under your skin.
Exactly.
both through my surgery, my reconstruction, the muscles, the anatomy, and I've seen the complications. So I learn from other people's complications, and usually they end up in my office. Something bad may have happened, and I learn and kind of learn from other people's mistakes. I don't try to put down anybody else.
No,
I
of
just
course
say
not.
that there's coach, there's premium economy, and there's first class.
Okay.
And I like to think that plastic surgeons and well-trained
Physician.
dermatologists and physicians, you fly first class.
Okay.
Right.
Okay. I think in my personal opinion as a practitioner, I think that I see different people, and I find that those who go to a physician seem to do a lot better and have a longevity when they do, fillers and stuff like that versus going to the med spas. I guess it might be concentration, it might be placement, because a lot of times you get the Botox for like $5, and you can get and that lasts about a week and a half.
You have to understand, we all buy the same product. It all comes from
Right.
one company, and it has to be reconstituted. It comes as a powder.
Okay.
So there's recommended filling, amounts that you
Right.
put in that gives you the appropriate concentration. I would say that some spas that want to get a little bit more
Bang for the
out
buck.
of their bottle, that would maybe dilute a little more, or use less of a concentration, or not put as much in a particular area in order to keep the cost down. And I can understand that's a business decision. We don't do that.
Okay. That's
Yeah.
important for
We
the
don't do
audience to know. Do you often have to deal with surgeries that somebody else did and now it needs to be repaired? Do you see a lot of that in your practice? Because I know there's a lot of women out there who are unhappy with the results
Well,
of.
first, let's just answer the filler question. We have a question from someone. How long will the filler last?
Depends on what type of filler you're injecting. On average, it's about 4 to 6 months. Everybody dissolves, it's protein, so everybody dissolves things at a different rate. Just like you give an aspirin to 10 different people, you get 10 different results. When it comes to Botox or Dysport, which is an injectable but works at a different mechanism, I tell people the faster it works on you, the longer it's going to last. So if you get injected and it works on you in like 2 or 3 days, there's a good chance it's going to last a long time.
I enjoy
If
that.
it takes a while for it to kick in and work, and you're constantly looking in the mirror and seeing, it's probably not going to last as long. Your body is chewing it up faster.
Oh, wow.
I have somebody that comes down from Connecticut once a year and gets Botox and never
All
has
right,
to
I
Wow,
get it
how
again.
nice for her.
And then I know,
or him.
lucky for her.
Yeah.
And then I have people that it seems like they're in the office every, 4 or 5 weeks getting something done because their body chews it up. And unfortunately, it's physiology. You can't play with that.
Wow.
Hmm.
Nothing wrong. There's nothing wrong with anything. It's just
Well, I
your
find
body
that
chews it
the,
up.
the Dysport shows faster the result.
It does. It's
than
a
the
quicker
Botox.
onset.
Yes.
It's about 48 to 72 hours, where Botox can be anywhere, 7 days, 10 days, up to 14 maximum.
It's kind of anticlimactic after you get injected. You're
Really?
like you said, looking in the mirror. Okay, when's it kick it in?
I've never heard of Dysport, so I don't know what that is. I literally it scares me. I'm so needle phobic.
Really?
I'm so afraid.
Oh, it does not hurt at all.
It
They're
does.
like
See, I find
tiny,
that women
tiny-
tolerate the needle much better than men do.
I don't even
men
notice
men
that.
get injected as well for Botox and Restylane. They
See, I
also do it
think
under
that
their
that's
arms
important.
for sweating,
Mhm.
Yeah, I have a guy who does
and they're
that.
wimps. Men are
Really?
wimps when it comes to the needle.
Really?
Women are much better.
Give it to me. Let's go. Next time you come on, you know what? We
Look at
should
you were
do that.
saying that you've been through a little
know.
tiny needle. You don't
I know,
feel
but
it
just
at all.
They're
It's
30
like
gauge. They're so
they're
small you don't know it's
tiny.
in. We could do it. We'll do it
Next time
on
you
air
come
in
on,
front.
we'll
You
do it in
can't. You
front.
can't escape the camera.
Oh,
We'll do it in front of the
Jesus.
camera.
All right, I'll do it. I'll be
I'll
the
be here
guinea.
for moral support.
You have to hold my hand.
I
That's
will.
the only thing, because I do the baby thing. I like giving needles. I don't
I was
like
gonna
getting them.
say.
Yeah, I don't.
What?
I'm not a big fan on getting them, but I like giving them.
I don't even consider.
So what
it
is
a
the
needle,
typical,
honestly.
like, for
They're so
example, if you
tiny.
have somebody who wants to come in for a tummy tuck, or we'll start with tummy tuck and then rhinoplasty. Tummy tuck, what is the downtime? Like, are they in the hospital or is it in a surgery center? What does that entail?
The operation itself, in my hands, depends on how large you are, is about 2 hours long.
Okay.
You recover for about 45 minutes to an hour in the recovery room, and I invite my patients to stay overnight in the hospital. It's 23 hours.
I enjoy
I
him.
think that the difference of just staying overnight, I tell you, it's like a spa day. You treat yourself. Why go home? If people want to come over and visit, you feel like you have to get up and do stuff for your kids or your husband.
Right.
This is your day. You've dedicated to yourself. You stay overnight. Nurse takes care of you. In the morning, often the patients are sitting there waiting to go home. And we send them home. And you're not driving for the first week. You're not going grocery shopping. You're up doing activities of daily living, but you're
Sounds
not
like
lifting
getting good
anything.
every day.
Yeah.
I mean, we could do this in May and be in bikini by June.
You'll
I mean,
be
come on.
you'll be going to the beach and working out in about 4 to 6 weeks.
Okay.
But that doesn't mean you can't walk around the block after week 2 or 3. You can't start doing activities.
Yeah,
Right.
no, I
Can't
think
keep
that's
down.
important. Any post-op, you should be walking around and things.
Mommies and women that have had C-sections and hysterectomies and stuff tend to do a little bit better because they've already had surgery. Women that haven't had surgery kind of don't know what to expect.
Because we're
But we
badasses.
talk you through everything. Yeah, we just talk you through everything.
So, now, I have seen, as a nurse, people who do the breast. And back in the day, they would stay in the hospital for a long period of time. And they have to, same thing with the tummy tuck, they have to wear a compression bandage.
Yes.
How does it work for, we're going to put it out there. My breasts, between losing the weight, having kids, and being 55 years old, the gravity, gravity's a law which they do not, they obey. So I would want to lift my breast, but I don't want to implant. Can that be done?
Yes, it can.
Okay. And is it more difficult?
No,
to-
you can get a nice shape to your breast, but sometimes the breast tissue is just atrophied. It's gone,
Right.
either from age or post, childbirth with breastfeeding. Everything atrophies. So you can get the shape that you want, but the fullness might not be there.
Yeah, I don't care.
So the implant doesn't necessarily make your breast bigger.
No, it just
just
fills it.
fills it out so that when you are not wearing a bra, it looks a little fuller.
I just want to be able to wear a tank top and no bra. I don't care if they're not.
So we
if
call
they're
that
little.
that's furniture disease. That's when your chest is in your drawers.
Yeah, exactly. That's true. But all you need is the handful and the mouth. So there you go. But I will tell you, no, because as you get older, gravity is not your friend. Things tend to go south really quick.
And that's
really
why
quickly.
God invented plastic surgery.
That's
so-
exactly correct.
Reverse
my
gravity.
theory, exactly.
Yeah.
So would it?
So what are some of the other things that you do in your office?
Now, do
Maybe
you
more
operate
of
in your office or
the-
at a surgery center?
I do
Less
minor procedures under local and a little oral sedation in my office. We
I
do
do
upper
want-
eyelids.
I want it on the record that both my children went to Dr. Dardano. One had a cyst removed from his chest, and one had a freckle removed from his lip. You would never know that there was surgery done. I'm not kidding around. I'm not just saying that. It's true. They
That's awesome.
they
Thank you.
recovered really well, and he was so good with the kids. So I can imagine what he must be doing with crazy women who are nervous like her. You were really really like so cool with them.
Thank you. So other things that we do in the office, fat transfer. I know it sounds like, it's a big
Can
procedure.
I donate?
To yourself.
Oh, it's a shame.
Instead of using the filler, one of the viewers asked, how long does the product last? Well, if you have found yourself coming back 2 or 3 times a year and you're like, you know what, I don't want to do this anymore, I can opt to take some of your own fat.
Now,
We
how do you
harvest
do
it in
that?
the office. Put some local anesthesia in like your belly or your hip or
Thigh.
wherever, thigh, and we can aspirate or suck out a little fat in a special syringe, and then sterilely we transfer it to an injectable syringe with a needle that's blunt, and I can fill in. The beauty of it is that the fat
It's yours.
grows in to your tissues, becomes revascularized, it becomes part of you. So technically it lasts forever. You lose a little bit during the transfer, right? A
would do
certain
that.
percentage of volume, but for the most part, it's you.
Oh,
And
wow, I
when
like
you
that.
transfer it, you also transfer, if you don't kind of we call it wash, but if you leave all the blood and stuff that comes out, that's plasma,
Yeah.
stem cells and PRP and all that stuff that people are injecting
I'll
themselves.
drink to that.
That's like a free transfer with the fat, and your skin can change and you glow. And one of my most popular procedures is to do a fat transfer in the office. Takes about an hour to do from beginning to end, and it's amazing.
And post procedure, nothing.
Ice. Just ice and relax
See,
for a
I
day.
like that because it's permanent.
It's natural.
And it's permanent. And it's natural. That's right.
You don't
It's your
have to
own
keep
product.
going back and getting injected.
I would
and
do
waiting.
that.
Over
You got
time,
enough to work with in the
you need
thigh area.
sometimes you need touch up over time.
Right.
You do a little bit more, but for the most part, you're done. I put myself right out of business. Sometimes I do such a good job.
Oh,
God
really?
bless you.
Love it, love it. I really like that.
Young people do it as well as older people.
What is your cutoff point? Like, do you take, like, if a 20-year-old comes into you and she's like, you know, pitch perfect but has the dysmorphia situation, do you turn them away and say, you know?
Well, dysmorphia can come at any age,
Yeah,
right?
but it's true.
Teenagers, 18, 19, wanting breast augs and fillers and, tummy liposuction, I usually don't do. An 18-year-old comes in and she has massive, gigantic breasts that
Of
are
course,
preventing
of
her from
course.
playing sports and taking her shirt off and feeling
Like a
like a
person.
normal person. Absolutely,
Sure.
those are operations that we do. Our society recommends operating on adults, so when they're less than 16, it's kind of tough. But
Yeah.
I've done teenagers, and I've done breast reductions in 75-year-olds.
Wow.
And you'll say, why would you do something in a
Because
75-year-old
they
lady?
can't
Well,
live.
age is not a contraindication to surgery as long as you're healthy and your doc says you can do it. We do it as long as it's not a large operation. But in the case of my patient, she had retired after having like 5 kids and a job, and she goes, I love to work in my garden. And every time I get on my hands and knees to work in my garden, I choke on my own boobs.
Aw.
Oh,
Because they're so large.
wow, yeah.
I just want to be able to bend over
And
and
that's
work in my garden. And my whole life, I had kids in college. I was
Good for
working. I was
her.
doing whatever, and now I'm doing this for me. and
Oh,
I said, you know what?
nice.
That is
enough for me.
enough for me. It's a great reason. There's no body dysmorphia going on.
For sure.
She had a legitimate reason that she wanted it done.
Yeah.
No, I
And
love
those
that.
stories they're motivating.
It's
they're
her time
great.
now.
And it's her
Yeah.
time.
It is.
That's exactly
I
right.
agree. I agree. I think that's
What
really cool.
is? Let's talk a little bit about what's going on with the lip situation
Please
around.
don't ever give me
Over
a trout
lips.
pout.
Yeah.
What's going on
It's
with
trout
this
pout.
duck
That's a
lip,
Pocahontas
duck-
trout pout.
This
I don't know how it got
is that in
so out of control.
It's bad
It's
though.
terrible.
There are some people that think that an over plumped lip is healthy looking, and I don't. I don't.
No, I
It's
don't.
ridiculous
Obviously, there are
looking.
some
Plump
people
is
with thin
okay, yeah.
lips and they just want a little volume.
Yeah,
a
a
little
little
goes a
bit.
long way, and I always tell people that you can
That's gotta hurt.
send the steak back and cook it more,
You
right?
told me.
If you overcook it, you're done. So
There's
you
a lot of
always add
overcooked
more.
steaks
Yeah.
Where do you
around town.
put, show the people? Where would you
know.
put it? Like, where do you inject? In right here?
I mean,
Well,
are
it,
they-
it depends on what area they're missing. The little hump that you have on your lip is called Cupid's bow.
I
right?
love my
It's that
Cupid's bow.
Some people have great Cupid's bow, some don't. And then on the red part under here is the volume part of the lip.
Right.
That may need to be augmented. Usually, I'm a 1 or 2 injector, a 1 or 2 needle injector. I'll just get one side, and I can cover the ridge, and I can cover the fullness through one stick, and I do the same on the other side.
And you see that when you put it in, right?
It's live. As I'm putting it in, I often have the patient with a mirror
Oh, I
look
love
when I'm
that.
finished, so that after I put it in, I ask them to look. Is that what you're looking for? And they can say yes or no. If it's not, I can fix
How
it.
long does that last? Again, it depends.
It depends.
Okay.
It
same
depends.
situation.
I haven't seen any of them go away.
Well, it depends now.
again.
The products that are supposed to go in the lip are, over time, resorbable, right?
Right.
There are some off-label products that docs and others are injecting in the lips, like silicone and stuff that
Really?
stays permanently.
Stop.
Sometimes fat, the fat transfer I talked about, if fat is put in a lip, it will stay. If you put too much in, you'll get too much.
And you can't fix that.
Can you fix that?
You can do like a little liposuck procedure to pull it out, believe it or not.
no.
Or you can inject it now
on.
with Kybella. We haven't mentioned Kybella, which is a great product that
What
dissolves
is that?
fat.
Really?
Yeah. Originally,
Why can't I drink that or put my thighs in it? That's all I want. Everything else is okay. except
something cool always comes from something else. The use
Sure.
has changed. Like Botox, was used
Right.
a long time ago for kids that were born with eyes that had strabismus, right? And my theory is one guy accidentally put some a little bit out here and his wrinkles went away. And
He's
these,
like,
oh my
bingo.
God, it's great.
Exactly.
But Kybella, the deoxycholic acid or whatever the chemical product is, used to dissolve gallstones. That's what it came from. We used to inject it into the gallbladder to dissolve the fatty gallstones. And
Took some
it,
fat
it's
with
been
it,
used
too.
in people for years, and then somebody got the great idea to inject it in a local area of fat, say in the submental region.
Yeah, I had asked
And what
someone
it does,
to do
it
this
just
who said no.
lyses
I
it,
didn't
breaks
do
apart
that.
the fat cells. it causes an intense inflammatory reaction for a few days, but it's actually it's amazing. Without liposuction, you can actually remove
Wow.
a certain amount of fat, inches of fat.
I gotta go sit in this stuff.
So-
I
Oh,
mean, it's
God.
amazing what you can do now.
Mhm.
These injectables and just going in and out of the office.
That's
I mean,
it's insane. That's awesome. I had no idea. That's pretty cool.
So what is your take on what we were saying before you came on before the break about men maybe feeling like they shouldn't get their wives one of these gift certificates because they might be insulting?
Well, you always fall into that, honey, do these pants or this dress make me look fat? You know, how do you answer that
Yes.
either way? Honey, do I need Botox? Or if the husband says, would you like me to buy you Botox or Dysport or Restylane?
I think you have to wait for the woman to come out.
Yeah, you might get it. Why? Do I look old?
Yeah.
Do I look wrinkled?
Yeah,
And
why?
you're done either way.
Exactly. It's a
So
touchy
get a post-it note
situation.
out, girls, and
So
put
you
it on
have
his
to be direct with the men in your
dresser
lives
and say,
Yes. I
this is
really
what I
have
want.
I really
You know,
want
we
this.
offer, there's different ways to do it. Gift certificates and ways you can give a gift or a credit and say, do whatever you need to do, honey.
I just wanted to give you the call.
Some guys don't know that their wives or girlfriends
Are
do
doing it.
procedures.
Exactly.
And
Absolutely.
when they ask, honey, can I go for some Botox? He goes, you don't need it. You're beautiful, just the way you are. Yeah, because I've been doing it
For
Yeah.
years. Exactly. On the QT. No,
So when
it's
they ask
so-
for it and they want them to pay
Then
for it,
do
they'll
it.
say, I'm not doing it because I like you just the way you are. You look beautiful.
Wow.
I know that a lot of the women that I know kind of hide the fact that they do it, and like they go to
Yes.
the grocery store and the grocery bill is $150 and then they buy a gift card for $100. So it's the grocery bill is now $200.
Well, you were
Public's money,
saying
yeah.
off air that no one should know that you've had anything done if you
Right.
get it done right.
I personally think that great cosmetic surgery is that when no one really knows that you had it done.
Exactly.
They might look at you and say, she looks different. She looks
Right.
good. She
Why
gets
do you
some
look
sleep.
so
Is her
happy?
hair
Exactly.
different? You have so much rest. You don't want your procedure to walk in the room before you do.
What is Vivian asking? My eyesight's really bad.
What type of filler for the lips?
There is a type of Restylane that we put in the lips. It's called Silk.
Oh, I
And
like
it's,
that.
It's
I want to get that done.
thinner, and it doesn't leave the bumps that you're talking about because lips are a little bit more sensitive. And I like Restylane.
Yeah. I I would be
Yeah,
a
I
little
gotta
bit
get the
sensitive.
bags. The bags
do you,
are the thing.
You know, there's not one that's any, I would say, better than others. You have your physician or surgeon should be comfortable with one. I stick with one, and I do a great job.
you
with
do
one.
a topical anesthetic though before you inject, right?
If the patient requests it.
Oh,
Most
it's
of the
not
stuff
cold
has
turkey?
no. Most of it has a local anesthesia
Chicken.
mixed in with it already. I'm a big proponent of the patient showing up a little bit early, and we have these nice little ice packs that we give you. And ice
Numb
or
it.
cold is an excellent anesthetic. And I numb it with ice as much as I can, and I use a very thin needle. And between that and the local that's mixed in with it, you
Big
might
Jenga.
flinch a little bit, but nobody jumps.
I'll be
No.
holding your hand.
Say no pain, no champagne.
Exactly. But this was very interesting. I learned a lot this evening. I hope that all of you do too. Is there one procedure that you really love out of everything, that you love to do, that you just feel like?
I love to do tummy tucks, and I love to do breast lifts. I
Oh.
think taking something that's
There you go.
just down in the dumps and breathing life into it is the greatest.
perky breast.
Making them perky, yeah. It's one
What
of my
about
favorite things to
laser?
do.
Do you do any of that?
We have a
in your
laser in the office. Do a lot of laser.
Where?
There's a whole, and you just name it. There's aesthetic uses of the laser for pores and wrinkles and tightening skin and dark lines under your eyes and freckles. And then the medical use, if you have a scar that may be unsightly, an area of disfigurement that is just irregular, a laser can shave it down and make it look a lot better.
Let me ask you a question. I don't know if I'm saying if you're the right person, but what about people who have tattoos that they want to remove? Do you take care of that?
I do not, because it requires a very special laser that it's a tunable
Okay.
dye that picks up the pigment color. And there's one or two in the area,
Okay.
physicians that have them.
Okay. Yeah, that was.
So these laser treatments that are done, they're usually in like a series, right?
Yeah, everything that we do with a laser, we try to do it in a series because people really don't want that, oh my God, I just burned my face off look, or they have to go into hiding for, 6 weeks. the fractional laser, which is what we have. You can dial up or down depending on the depth.
Okay.
And sometimes if you really need a laser, we'd go a little deeper.
Okay.
Let you heal up for a month, do another little treatment. And that
Okay.
way you get back to work a little faster, you're not as red for as long, and you don't have to like peel your face off. Excellent results. I say the least you do over a long period of time works a lot better than all at once.
Yeah, I know.
See, and then your husband doesn't even have to know.
It doesn't.
Oh,
Little by
they'll
little.
know if you have a laser.
Small by
Oh, they'll know?
small by
Okay.
small.
Yeah, you can't hide that for
Yeah,
too
no,
long.
that's- honey, the vacuum attached to me, and that's why I'm all
Yes, I just
yeah,
fell into
just
it.
fell into it. But no, it's pretty amazing, and it's I love the fact that it's like you can do a lot in the office and a lot that you
Yes.
don't have to do with surgery
We-
initially.
We call it stacking. You
Okay.
stack non-surgical procedures, and when they all add up, it's almost the same as if you did an operation.
Okay.
So you fill in where there's volume loss. You treat the skin, because there's quality of skin and quantity of skin, right?
Absolutely.
You treat the skin with a laser or a peel or a PRP facial, and the two of those things together, you do a little Botox. So you stack those three non-surgicals. Plus now we have thermage and little things that can heat up your skin and tighten the collagen. 3 or 4 things together, it's almost like you've had a lift without surgery. It might not last as long, and it might be as dramatic. I mean, if you have turkey gobbler
That's
neck,
coming right off
there's no
myself
cream.
in the kitchen.
no cream, lotion, salve, or jelly that's going to
No.
get rid of it. Sometimes the simplest thing
Scalpel.
is actually doing a scalpel.
Yeah. That's
And
gotta
that's
go.
where we, as surgeons, guide people. Not every surgeon should talk you into surgery. I mean, a
Right.
good surgeon knows when not to operate
Exactly.
and gear the treatment towards you,
I love this.
what you want.
So, gentlemen,
Yes.
ladies, go ask your significant other. Say this is what you want, and
This is what I
don't
want.
be ashamed. I think it's amazing that you can make yourself feel better because I think mind over matter has a lot to do with how you approach your life, and if you feel
Absolutely.
good about the
Yeah,
way
if you're
you
looking
look,
in the mirror every day and the same thing is
Right.
bothering you over and over and over again, you should
I
fix it.
agree. Your mother says
Somebody
that she
says
needs
mommy
all
needs
of those
all of
things.
this. I saw that.
That's her mother. That's her mother. There's a question. Have
Well,
you ever?
you're pretty healthy, Mom. You might
John,
pass.
you're beautiful. Knock it off. Have you ever heard of using Juvederm to fill in under eyes?
Yes, absolutely.
Okay.
It's one of the treatments we were talking about earlier. There is a way that I do it where I dilute it a little bit, so it's a thinner type of product, and it takes about 30-40 minutes to do it in my hands, and I can actually fill in some of those dark creases under your eyes. That really looks good, and it lasts a while.
That's amazing.
Yeah, mine's hereditary.
I'm
It's
coming.
just-
I'm telling you right
The
now,
whole
the bat
family.
wings. The bat wings are
My
going.
whole
Johnny,
family's
we'll
got-
go together.
We all got these
You and I.
black circles.
We'll go together.
It's all
so,
camouflage.
So, Dr. Dardano, how do our viewers get in touch with you?
Or you can call my office at 561-361-0065. My office is right here in Boca Raton across from the hospital on 13th Street. Or you can email at drdardano@drdardano.com, and we can respond with a question and set you up for a consultation. The cosmetic consultations are complimentary. Gives you an idea of what questions that you have. We can kind of put you in the right direction, and you get to visit all the ladies in the office and see how the office works.
Good. I like
They're all
that.
lovely.
Yes, they are.
Very nice office.
Very, very sweet. Very, very sweet. Well, are you going to come back for us?
Absolutely.
He's going to
Whenever
do
you
my
want.
face on camera. How do you like that?
And if you get anything for your mommy makeover, you should share. Share
Yes.
your
Yes,
experience.
share your
photos.
pictures, share your photos, share your experience. It'd be really cool. And you can find us on Facebook at Two Birds from Boca.
And
Instagram,
we have
Twitter.
an event coming up next Tuesday in
Oh,
preparation
yes.
I
for
was just
Mother's
gonna
Day
say that.
on
Will you
the
put
8th.
that up, please?
And I think we can put it up for those. It's at 5:30 to 7:30 at my office. You can come visit the office staff and see what we have to offer. Look at the facilities, get a tour, answer your questions. It'll be fun. There's
be
some
a lot of
giveaways
fun.
and gifts, and there'll be food,
And
champagne.
What day is this?
Not this Tuesday.
Tuesday the 8th.
Next Tuesday.
Okay.
Right?
There
Yeah,
it
Tuesday
is.
the 8th.
It's a women's beauty event.
So this is a perfect opportunity, actually, for you to come in and, like he said, take a tour of the office, meet everyone.
Meet him.
Kind of look at what the options are, up
Now,
close and personal.
we'll put all this on our
I
page.
will. I'll put all this
We're
up.
going to put everything up on our page for you guys, so our local peeps. But you know what? he also takes people from out of town. So if you happen to be wanting to fly in and wanting to speak with a good plastic surgeon, he's your guy. There you go. Get a Spirit flight,
Thank you.
$100 round trip. Here you go.
I like when you do these events. It's nice because it gives people, because you're relaxed going in there. And
Yeah, it's not threatening because you're with
Yeah.
other people who are there,
Uh-huh.
and it's kind of more like a seek and find out
And
mission.
there's always something new coming out and something.
It's so
you
nice.
know.
That's so
I
good.
really
And
like
that's
it.
a nice thing to do.
Mhm.
I've never heard of that before by a plastic surgeon. I think that's a really
It's
nice
very
thing to
nice.
do. Maybe we'll go
What do you
there.
expect?
You're
from
both
a
invited
paisan?
on
Paisan, it's a lot of vowels right here.
We don't
a
fool
lot of
around.
vowels in this room.
You can eat all you want. We'll remove it with
There you
liposuction
go.
later.
But seriously, you say that, and it's not funny because there are certain things that you can exercise forever and in 17 days. It's just not going to come off. Like that little knee fat, it's never coming off.
I know.
You got to suck it out.
You
It's,
do.
it's kind of a
only so
genetic
much you can do.
distribution of fat. There's certain places
I got
that,
the mother load of genetics here.
right, diet and exercise are just not going
Right.
to take care of. That's why, again,
Right.
why God invented plastic surgeons, so we can take care of those areas where you cannot.
And if it's the best. Honestly, though, as speaking from a practitioner, I think it's really important that you go to somebody who's board certified and you go to somebody who's reliable, who's done this several thousand times, and
And that you feel comfortable with.
safe. Exactly.
Mhm.
And that, at the end of the day, your corpse is not going to be a good idea. You need to go to somebody who's reliable, not the guy in the garage in the back that's going to give you Freon in your butt. So it's really. Do you do any butt implants?
No, I don't. I
Thank
chose not to
God.
do it.
Because I find
I will tell you, almost every single day I get asked.
no way.
Really?
Every single day.
Stop.
No, if I'm doing a tummy procedure or a lipo, can you take some of that and put it in my behind? And I just don't do it. There are some docs that do an amazing job, and that's all they do. But I just have chosen not to do it.
That's
Do you-
another thing that's getting a little out of control because the waists are
Is
like
this
this.
well,
and
that's
then
well,
it's-
the bigger the
you
butt,
put
the-
your
the
drink
smaller
on
the
it,
waist.
on the butt.
I want to get rid of that.
It's just, but
Yeah,
how
I
do they find clothes? How do
I don't
you
know.
find
I don't
clothes
know.
that fit?
I
don't
think
know.
they like a size 14 and then a 2. I don't get that.
Yeah,
It's
the
gotta be
world is full of
custom.
haves and have-nots, right? Those who have big butts want them liposucked. Those that have no butts want them filled up with implants. Or
I just
like,
want to be born again. I want to be, and I don't mean religiously either. I just want to start fresh and figure it out from there. But I honestly thank you so much for coming, Lorianne, and I really are always happy when you come here.
And we're going to
It's just
see,
Thank you.
all of us are going to be together Saturday.
We're going to be
Yes,
together
Saturday
Saturday
night.
night. Yes, we're going to have a good time.
at the American
all
Cancer
dolls
Society
up,
Gala Saturday night.
unrecognizable, fabulous.
With your sombrero.
I'm not.
And it's a good way if somebody wants to donate, right? I think I have
Very good.
an item or two that's going to be
Auctioned off.
auctioned off. So
I
if you
bet
want
There you
to
go.
I'll be betting
have
on
money
that.
go to a good cause and get something
Excellent.
from it for your
Thank
loved
you so
one,
much
There
for
you go.
doing that.
we can auction off something.
That'll be great.
There you go. So, all right, guys, we're going to call it a night, but we want to thank you so much for tuning in. Again, this is Dr. Anthony Dardano. He's in Boca Raton, Florida. Just give us your phone number one more time
561-361-0065.
and your website.
drdardano.com.
There you go. Thank you for tuning in. We'll see you next week, and it's going to be a surprise because we really aren't sure what's going to be happening next Monday. But have a very good week, and thanks for tuning in, and we will put everything up on your Facebook page.
Bye, everybody.
Bye.
Bye.
Thank you for joining the Two Broads from Boca. You can see us live every Monday at 7 p.m. on Facebook. See you next week, and remember, keep it classy, sassy, and a little smartassy.